You know, every mandibular fracture looks pretty simple until you actually try to get to it. And then suddenly, you're navigating a minefield of critical nerves, blood vessels, and muscles. So today, we are breaking down one of the most powerful surgical roadmaps to the jaw, the submandibular, or Risdon approach. We're going to cover where to cut, what layers to expect, and most importantly, how to do it safely.
Here's how we're going to tackle this. First, we'll look at why this approach even exists and why it's so crucial. Then we'll map out the incision, navigate all the layers down to the bone, see the final payoff when the mandible is exposed, and then we'll wrap it all up with the most important surgical takeaways.
So, let's ask the big question. What makes getting to the jaw so tough? I mean, why not just make a simple little cut right over the break? Well, the answer is all about what's lying in wait just beneath the surface. And yeah, this image really says it all. The mandible isn't just sitting there under the skin. It is wrapped up in layers of muscle, fascia, glands, and a whole web of major blood vessels and really important nerves. So reaching the bone isn't a straight shot. It's more like navigating an anatomical minefield where one wrong move can have some pretty serious consequences. And that's exactly why surgeons don't just, guess. They use a precise roadmap. And in this case, that roadmap is the submandibular approach, designed specifically to navigate all that complex anatomy safely.
Sure, you can fix some fractures from inside the mouth. But what happens when a fracture is badly displaced, or shattered into a bunch of pieces, or it's gotten infected? You need a wide, clear view. You need space to put in some strong plates and screws. And for those really tough cases, an intraoral approach just isn't going to cut it.
And this is exactly why surgeons love this approach. It gives them a wide-open, direct view of the jaw. This means they have fantastic control to perfectly line up those broken pieces and lock them into place. And maybe the best part? The scar can be beautifully hidden in a natural neck crease, which makes it almost invisible later on. Alright, so we know why we use this approach. Now let's get into the how, starting with what is probably the most critical first step, mapping the incision. Because where this first cut is made can really determine the success and the safety of the entire operation. Now listen up, because this is probably the single most important measurement of the entire procedure. The incision absolutely must be at least 1.5 to 2 centimeters, that's about a finger's width, below the edge of the jaw. This is not a suggestion, it's a critical safety margin to protect a very, very important nerve. And for the best cosmetic result, placing that cut inside a natural skin crease, like you see in option B, that's the way to go. Okay, once that incision is marked, the real journey begins. We are going to dissect down, layer by meticulous layer. And trust me, understanding each one is the key to success. So our path to the bone goes through 5 distinct layers. We're going to start with the skin and the fat right under it. Then we'll meet the very thin platysma muscle. Deeper than that, we'll navigate the fascia, carefully handle the facial blood vessels, and finally get through the muscular sling that's wrapped around the mandible itself. Right after you get through the skin, you're going to hit the platysma. It's this thin sheet of muscle. The surgeon carefully divides it to find what's called the subplatysmal plane. Now I want you to think of this plane as the safe surgical highway. It's the correct path that guides us deeper while avoiding all the major danger zones. And this is why that safe highway is so incredibly important. Let me introduce you to the final boss of this procedure, the marginal mandibular nerve. This tiny little nerve controls the corner of your mouth. If it gets damaged, the patient is left with a permanent crooked smile. It is the one complication we absolutely, positively must avoid.
And what makes this so tricky is that this nerve doesn't follow a predictable map. It doesn't read the textbooks. As you can see in these images, its anatomy is just incredibly variable. Some people have one branch, others have several. And crucially, it often dips below the jawline, right into our surgical path. This is exactly why that finger's width safety margin for the incision is absolutely non-negotiable.
As we continue deeper, we run into our next landmarks, the facial artery and vein. You can actually feel the pulse of the artery in a small notch on your own jaw. Now, to keep the surgical field clean and blood-free, surgeons will carefully tie off these vessels. Once they're controlled, the path to the bone is wide open. Okay, so we've navigated the nerve and we've controlled the vessels. Now for the final approach. The target is in sight. The final barrier is this tough, muscular sling that's wrapped around the jawbone. A surgeon will make a very clean incision right along the bottom edge of the mandible.
This spot has the fewest blood vessels, which means less bleeding and a direct, clean entry right onto the surface of the bone.
Using an instrument called an elevator, the surgeon lifts that muscle sling off, and boom, there it is. A perfect, wide-open view of the jaw. The fracture is clearly visible, and now the surgeon has all the room in the world to put the pieces back together and fix them securely with plates and screws.
So that was the journey, from skin all the way down to bone. Now let's lock in the most important lessons from this whole thing. What are the key takeaways?
Success here is all about finesse, not brute force. The biggest mistakes all come from violating that simple principle, cutting too high, getting lost in the wrong tissue plane, or just being too aggressive. The key is to know the anatomy, respect it, and dissect with precision, not with power.
So just to recap, when is this approach the go-to? Well, think of it as the workhorse for any complex fracture of the jaw's body or angle, especially if it's infected, not healing, or it's been shattered into a bunch of pieces.
All right, let's do this. Let's recap the whole sequence in 6 quick steps. 1. Incise, a finger's width below the jaw. 2. Divide the skin and platysma. 3. Dissect in that safe subplatysmal plane. 4. Protect the marginal mandibular nerve at all costs. 5. Ligate the facial vessels. And 6. Expose the bone. That's it, that's the whole sequence.
Hey, if you found this breakdown of a real surgical approach helpful, make sure you're following us for more. We're all about ditching those dense textbooks to make complex surgery simple and clear.
I'm going to leave you with this final thought to really lock in the most important lesson today. When you consider every layer and every single step we just walked through, what is the one single structure whose safety separates a masterful operation from a surgical disaster? The answer to that really defines the essence of this entire approach.